George Sledge, who is one of our partners, gave a wonderful talk a few years ago, and he categorized tumors into two types. There are smart cancers and stupid cancers. And he put testis cancer in the stupid cancer category.
Or was it the doctors who treated? I can't remember. It was one or the other.
Yeah, I fell asleep during this talk, but I saw the Cliff Notes version of it. But the stupid cancers are the ones in which you can give them one drug, like Gleevec, or you can give a combination and cure them. The smart cancers are the ones that have many different mutations and lines of defenses. And this is a little bit like Al-Qaeda and ISIS right now. These guys are smart terrorists, and for us to think that we could have a drone and kill off ISIS isn't going to work. We're going to have a multi-targeted approach to get rid of them. And in cancer, the same thing goes. Now, we have these genetic mutations, and it is, as Dave was alluding to, this whack-a-mole. As we treat one target that we know is that we're hitting cancer, and we may kill off a population of those cells, the other group of populations of cells grow, and so actually another target becomes more important. So eventually, I do think, this is going back to my engineering background here, that we will require essence of informatics and engineering to help us come up with a solution so that we can actually diagnose what are the key important critical pathways for genes and know that ahead of time. And instead of just dabbling with one drug at a time, we can actually say, okay, there are 5 key points, and we're going to hit all 5 of those at the same time. And these 5 points in your husband is going to be different than the next person over here who has the same cancer, because their genetic makeup is different. To make a point of this, if you have identical twins that were born 50 years ago, and you look at their stem cells are the things that repopulate your bone marrow and everything else. If you then look at these twins 50 years later, there's already 400 mutations that differ between these two twins. And so these 400 mutations in their stem cells now make up the backbone of this new cancer that's developing in that background. So every cancer is really totally unique. What we're stuck with doing is we have a key, like a key to your house or a house key that has all these ridges. But these ridges are changing with time, and we're trying to find the right lock that fits in there, and it's a lot of hard work. But I do think, in the next 15 years, we will have the engineering and the computer technology to be able to help move this a lot further ahead than where we are right now.